on top of that. Here in Australia, we've got Parliament back for the final fortnight. There's a private member's bill, and it's a little unclear exactly how this might work, but essentially what Pauline Hanson wants is for the Commonwealth Government to stop states being able to have vaccine mandates. She's bringing on this as a private member's bill. It has seemingly been prioritised by the government. They've allowed her to do this. They're allowing government MPs to cross the floor. And debate so far has been very much vigorous, perhaps you'd call it. Jackie Lambie has just been weighing in. We'll play you some of her comments.
Politicians like Senator Hanson and Senator Roberts are using people's fear to boost their own election campaigns, and they're using fear to make money. And that's what this is about from One Nation. They're not being straight with you people out there, not straight at all. It's all about cash, it's all about power, and it's all about One Nation seats. And that's all this is, a grab for cash and seats from One Nation. We don't have lockdowns and border restrictions because state premiers love discrimination. That's rubbish. We have them because state premiers don't want people dying, because they don't want to be playing Russian roulette with their own people's lives. That's why they're doing it. You are patriots. We should be celebrating vaccinated Australians. You're fighting for our freedoms, to take control of our lives again. That's what you're doing. And good on you. It's a proud day for you today, and so it should be. Good on you for showing the courage to do so.
The passionate views of Jackie Lambie, my panel, are here to discuss all of this. Julian Hill and Julian Simmons, good to have you both in the studio and good to have you back on the program. I might start with you on this. What's your view on states and the vaccine mandates they have? I suppose there are two. One is when they force workers to have vaccines, including healthcare workers, to stay in the job. And the other is rights for people who are not vaccinated to go to things such as cafes. What are your views on those two moves?
Well, look, as you point out, it is state governments who are bringing in these mandates. I mean, we've deliberately chosen as a federal government not to mandate the rollout, and except for in cases where we've got them working with vulnerable communities like the aged care. And despite that, we've been able to encourage over 85% of Australians to get double vaxxed. And so we're one of the most vaccinated nations in the world, and that's through encouragement. So we certainly support freedom of choice, and we would encourage people to get vaccinated. We wouldn't mandate it ourselves.
So the PM's been big on saying, look how good the vaccination rates, and they are, but also whole populations in New South Wales were only going to get their freedoms back if they got vaccinated. Isn't it a bit rich to say we've always said it's about choice, but then claim credit for the high vaccine rate? Hasn't part of the vaccine rate come because people were cajoled into getting it?
Well, we've been encouraging them. I mean, you know, we've had Labor talking down the vaccine rollout as we've been going along. Every time they talked about supply issues, we know that encouraged people not to pick up their phone and make an appointment with the GP. We pushed through that. And Australians have rolled up their sleeves in record numbers. You know, look at my own state in Queensland. You know, they spent a lot of time, the Premier, talking down the AstraZeneca vaccine, for example, and now to lift their numbers, they're having to mandate it. And I think what we've shown elsewhere in the Australian community is that if we encourage people, they'll do the right thing and they'll...
So let me just clarify that. In terms of a broad vaccine mandate, for example, anyone wanting to go to a cafe, even at 80% double dosed in your state of Queensland,
well, we haven't done it as the federal...
Do you agree with that?
We haven't done it as the federal...
Do you agree with it?
Well, I think that there should be freedom of choice, right? So, no, I don't agree with a mandate. I think businesses should have the choice. Like, if businesses want to say we only want vaccinated customers, if they want to restrict their customer base, then they can make that choice.
So you don't agree with the state limitations?
Exactly right.
Including in New South Wales, which is still...
I don't think this is something that government should do, of any ilk, should be mandating vaccines, and it should be a choice for businesses and a choice for individuals.
What's your view on this?
Well, what we've just seen is a perfect illustration of the mess the government's in. They're trying to claim credit on one hand for the fact Australians have done the right thing, rolled up their sleeves, and we are now one of the highest vaccinated countries in the world, and yet on the other hand play footsie with the extremist right. That's what we're seeing. This is no longer a public health debate. Let's be clear. The vaccines science is settled and Australians' attitude to vaccines is settled. Now that finally the government has got some supply, we were near last in the developed world. We finally caught up. That's a fact. Now that we've got supply, people are taking them. And you want to talk about freedom, which is what this is about? These people at the rallies, they're not carrying protest signs over all about vaccines. They're campaigning for freedom. You know what freedom is? Freedom is the ability to open our society from Scott Morrison's lockdowns that were only caused because you didn't get enough vaccines, without tens of thousands of our fellow citizens dying and the hospitals being overwhelmed.
Take a breath,
That's
Julian,
what freedom
there's differences between
Most
those
Australians do not want to go back to lockdowns, and this is the other point I'll make.
Yeah.
This pandemic ain't over, right? This kind of mixed messaging, having a bet each way, this is not about public health. This is a race to the bottom to chase the votes of extremists because your government is being ripped to bits by people like Matt Canavan and Jared Rennick and Craig Kelly.
I want to follow it up.
I won't cop because there's a big difference between
it's a grubby
those
political debate.
who are in those protests who are advocating violence, which we absolutely would not support, with advocating a very fundamental tenet of the LNP and the coalition government, which is freedom of choice, and saying quite clearly that if we were in the state government in Queensland, for example, we would have done things very differently. We wouldn't have had these mandates. We would have encouraged people. We would have allowed people to come across the border from New South Wales.
The Prime Minister condemned people for buying toilet paper more strongly than he condemned people turning up to a rally with nooses threatening violence.
Let me ask you about this. So the issue we have right now is our overall vaccine rate, single dose, and that's the best measurement of who's getting a dose, who's going to end up getting double doses. 91.5%, really good. Consistently, the anti-vax measurement has been 1 to 2%. What we're going to have is a small number of people, but it might be 4 or 5% of the country, who are not anti-vaxxers, but they are vaccine hesitant. The question is what to do with them. If we take away their rights, is there a danger we push them towards that 1 and 2% of becoming anti-vaxxers? Don't we need to be wary of that?
You're absolutely right. There's a spectrum and a distinction, and I talk to those people. I will answer the question, but just the context point. We've just heard that these guys, when it suits them, are against mandates. The Prime Minister himself stood up months ago and said there's going to be consequences for people choosing not to have a vaccine. It's consistent with the national plan. It was only a few years ago that he introduced laws, we can quote the speeches, saying if you don't get a vaccine and you don't protect others, you won't be able to go to a playground.
Well, I want to clarify that. Because
no jab, no play, no jab, no play.
What the national plan spoke about,
no jab, no play.
What the plan spoke about was limitations on the unvaccinated begin to end at 80%. Is that the view? And I just want to clarify this, so that you supported states having mandates up to 80% double dose, but once they get to 80 and 90, that's when the unvaccinated should no longer be left out. So is that your view?
Yeah, that is my view, that absolutely the national plan says that at 80% these restrictions should be lifting. And, also it was only the national plan's view that those restrictions should be in place where there's an outbreak. Take Queensland, for example. There isn't an outbreak at the moment, but those restrictions on unvaccinated people will come in regardless of whether there is an outbreak or not. So that's not consistent.
So that's what I wanted to clarify. And then that's my question for you. When we look at New South Wales and Victoria, which has spoken about restrictions for the unvaccinated all through 2022, even when it gets well in excess of 90% double dose. Is that the right approach? That's the question.
Yeah, well, the point you're making there, I think, is that we're seeing a difference in an approach between different states and territories in matters of detail. But overwhelmingly, the states and territories, Labor, Liberal, this is not a partisan fight. The public health advice is clear. If we get the vaccination rates up, people protect themselves, their family and the community and the health system. So all the states and territories have been... And the Prime Minister's been clear there are consequences. He's mandated vaccines in other settings, be it in the no jab, no play, no jab, no pay. The words could apply exactly the same to these situations.
But not everyone who
so I'm not going to run a commentary on the individual rules between
hang on, but this is not... I mean, with respect, when you say not running a commentary, we've both had a whole lot of comments on a whole lot of things.
I said on the individual rules between the states.
But my question is a blanket one, is 80 or even, let's go more conservative, 90%. At that point, should we stop limiting access for the unvaccinated in our community to make sure we're not a divided nation?
Yeah, so the point you made before is right. There's a very small percentage of people who are anti-vaxxers. They don't accept the science. Some of them probably are crazy. They believe conspiracy theories. You can't do anything about that. There are vaccine hesitant people, and I've spoken to them. They're not crazy. They made a choice, and the consequences of those choices are really serious. But we also know...
Should they endure?
We also know from the science, and I've also heard, as you would have, from a lot of people who are vaccinated, who are worried about the fact that you're more than 20 times more likely to spread COVID if you're not vaccinated.
But the higher we get as a vaccination overall, the lower that health risk, but the greater we're going to push this 4, 5, 6%, whatever they are, into the arms of anti-vaxxers. And that
Yes.
can be a long-term, generational problem for Australia.
Look, my point remains, this is not a public health debate. The attitude to vaccines in Australia is overwhelmingly settled. This is a grubby political debate.
But they're not settled, and this is the problem, whether or not this shakes up the vaccine hesitant and puts them into that other
People
category.
aren't going to go and get unvaccinated, are they?
No, but they
Remember,
might stop getting
the vaccine
vaccinated in the
rollout
future.
is not over.
They might not get a booster shot.
The vaccine rollout is not over. What we need is national leadership from the Prime Minister to
We've had
encourage
the PM
confidence.
encouraging people to get vaccinated.
To
for
encourage
18 months.
confidence.
why we're
We're
one
going
of
to
the
be
most
back down in
vaccinated.
lockdowns next year
I've
if you
got
don't
to-
get the booster shots right. That's what you mob need to be focused on.
We've got to
instead of
leave it
ripping
there.
yourself to bits.
Good to have you back in the studio. I'll just note that the vote we're all talking about in the
Yes.
Senate, 5 to 44, it went down. It was not formally counted, because only Pauline Hanson and Malcolm Roberts are only attending remotely. So the 5 votes all from the LNP, which will ensure a good party room meeting
Sure.
tomorrow. You can tell us.
It's
all about
always vibrant.
it. The 2 Julians. Thank you. Well, South Australia.